Hello, everybody. Happy New Year in advance. Merry Christmas, and I hope you're enjoying your holiday. So, I've been thinking, and there's this thing that we are not, people are not asking questions about. And I'm just walking down the street and I'm seeing, children with these issues, special kids. So they're lovely, they're nice. But I'm just like, how is it possible that in every 10 children that you see on the street, five or four of them is a special child? So I'm like, let's talk about autism. What is going on? Yes, fine, there's always been autism, but not as it is now. Like back in the days, let me speak for myself, I don't see cases of this, very common. But now you see, like, in every five five children or kids that have been babies that have been given birth in the hospital, two of them will be like a special child. And I'm like, what is going on? Is there something that we breathe in when we're pregnant? Is it the food? Is it the water? Is it the environment? Is there something that they're not telling us? Because this is actually getting out of hand. So I'm thinking out loud and I'm like, maybe we should start discussing about this thing called autism. What causes it? Why is it that it is common now? What is going on that we don't know? I mean, does the government have any explanation to do? Or is this something that we are eating? Is it the environment? Is it the air we breathe? Is it the water? Even in Africa now, it's common. Like, it's getting too much. I'm from Nigeria, Africa, but we hardly have these situations. But these days, it is common to us in Africa. And I don't know if this is a world situation or just a country thing, because I used to see it a lot in Sweden. I'm like, Sweden, there's too much of this autism. But right now I'm like, no, it's everywhere. Something is actually going on that we don't know. So I'll actually need someone to, if you are a professional in this field and you think you have any idea, please just inbox me. Let's fix a date that we can go on live and we talk about this autism, special kids, okay? Because we really need to know what is going on. If we need to ask questions, we need to ask questions, because these children needs our help, and it is not easy for to take care of a child who does not need a special, special need. Not to talk of having children with special needs. Today you hear all sorts of things. I don't know. We need to talk about this thing, autism. What is going on? What are we doing wrong that we're having it too much in our society? Africa is experiencing it. In fact, all the continent that I know about, they're experiencing this thing. And this is not common in Africa before, but now it is like, common. Even African families that live here, that live abroad, they now give birth to children with autism or with special needs. So please, let's talk together. Let's leave the differences. Let's talk together about what is this thing called autism and why is it common now. So please, private chat me if you are good, you're a medical doctor, you have an idea about what this autism is, you have something to say about what pregnant women should take, should eat, where they should go. Okay? So we can help people, because it is getting too much. You see them in the train. It's too much. Let's talk about it, okay? Autism. We need to talk about it. We can't hide away from it because it is getting out of hand. And we need to help parents, and we also need to help expecting parents too. People who are expecting to have children. Let's do this together. So please, private chat me so we can fix a date that we can go live and talk about autism. Thank you so much, and God bless you. Bye bye.